by the IQAC and the UGC, but it's going to be a new approach in teaching methods in our institutions. Maybe it's not only the mandated by the IQAC, but also it is required a little bit of the pros and cons regarding this activity is very essential. For this, we having this particular program, I'm congratulating the NFI Dental Education Unit. At the same time, I congratulate and thank Ashwini Datta sir. Made a point that in spite of his busy schedule, he said that he is going to be with us today for this particular program. Nevertheless, this flipped classroom is a one thing wherein we are got used to these traditional teaching methods, wherein teaching is we go and take a lecture in the lecture hour, wherein this reverses the method, wherein this flipped classroom gives you an idea, wherein the importance of the theory classes have been provided well in advance to the students, wherein and in the classroom when the patient comes over, wherein we need to use this particular the knowledge into the practice, either problem-based solving or making others to understand why important of this learning these topics. So there's a two-way of learning comes into the students. Students will get the knowledge in well in advance before coming to the classroom. And there will be a one-to-one teaching in this particular area. And the one thing that I can able to assure you that in dental college is that we have 126 staff members, wherein number of students will be around 700 students. So 1:6, it comes into the picture almost. So 1:5 is an ideal for this particular kind of a program, but we have at least one extra. But still, we managed to do this particular thing. We looking forward to listening from the Ashwini Datta sir, so that we can able to tell us what are the pros and cons of this particular thing, and without wasting much of your time of all the staff member in the teaching clinics, I hand over this particular podium and this thing to Dean Academics, Dr. Ashwin Datta sir. Thank you so much, sir, on behalf of the entire dental college, staff, students of the NFI Dental College. Welcome you to this particular program, sir. And thank you for taking your time out and coming all the way here. Thank you, sir. Thank you, everyone.
So good morning to all of you once again. So let me share my screen. Are my slides are seen?
Yes, sir.
Yeah. Thank you very much. Very good morning to all of you. Respected Principal Sir, Dean Sir, heads of the departments, the faculty members and the coordinators of Dental Education Unit. So very good morning. So Principal Sir has made my job much easier because almost 90% of the content he has completed. So there is no requirement of my session as such. And my apologies again because they requested me to have an offline session. But as you know that we have got multiple other commitments here and coming there, and if some of the faculty they have missed attending this session, so it may not be beneficial for them. So thinking that in mind, so why can't we record this, and those who have missed can be used. It's another form of flipped session on flipped classroom itself. So thinking that in mind, so this was proposed that why can't we have it in a digital mode so that it will be beneficial for everybody. So this can be used at a later time also. That's the intention. So before we actually move to this session, so let me congratulate the leadership, the principal and the dental dean and all the heads of the departments for having taken their time and recording the videos in Media Center. As you all aware that in the previous NAC session, the e-content development was one important component under the teaching, learning and assessment, the criteria 2 of the NAC. And the number of e-contents were not at all delivered, and where we were invited as resource faculty at various conferences or various sessions in other institutions. So those which are already there on the YouTube those links were uploaded to our learning management system as if these are all developed here itself. So that was the intention, and we could not achieve much. Whatever which was available, nearly some 78 videos were available, and these were uploaded to our learning management system, giving the link of those YouTube videos. But now there are 315 videos which have been recorded in the N Media, and being the chairperson of the content validation review committee of this N Media, I have gone through all these 315 videos, and the quality of the presentations and the initiation that have been taken by the leadership is highly commendable. The number of recordings from the dental college are much more compared to any other institution, and in fact some of the procedures also have been demonstrated, some directly in the dental college and some in the media center. So I congratulate everybody for this successful implementation of the first part of the initiation, that is the e-content development. Then when we were discussing, so many videos have been uploaded, but hardly any students are viewing that. Is it just because, is it a requirement of the NAC that we have taken this initiative and the videos are there on the N Media and nobody is looking at that? The quality of presentations are too good because every faculty, they have taken so much stress in preparing these videos, making sure that they are as per our checklist and as per our guidelines. Some of the presentations which are not up to the mark, we have told them to redo the whole process again. So with such pain, and if that is not being used by the students, so what's the use of creating these highly very good content videos? So then we had an internal discussion, so let's have a flipped classroom using these videos. So that's the whole concept of the IQAC sending the mail. It's not just the IQAC, it's the internal discussion. Everybody at the university, we had an internal meeting, and then the notification came from the IQAC. That's all. So it's the decision by the university that we need to have these flipped classroom sessions for all the students of all the constituent units. So that's the background for all these activities which we are doing. So let us mainly come to the session now. So can anybody tell what is missing in today's classroom? I can't see the chat. So if you can unmute and tell me some responses, what is missing in not my session, not today's classroom, online classroom. I'm telling in about generally in all our theory classes or in our small group teaching or large group teaching, what is missing?
Students participation.
Students are there, no? They are
No,
attending.
active participation.
Active. What do you mean by active, madam?
No, they don't. If we ask questions or when we they don't respond. Rather, they will be just listening.
Exactly, correct. So what is missing in today's classroom, as rightly pointed out by everybody, it is the interaction. So the interaction is missing. Then we have got nearly 250 MBBS students, and dental you have got 100 students, and difficult to have that 40 minutes or 45 minutes of theory classes to be converted into an interaction where we can interact with all the students. So that will be an Herculean task. So that is one difficulty. Let us see. And most of the theory classes, thankfully I searched for such images on the Google. It didn't show anything related to the Indian students. It all showed about the students of other countries. So probably we have not taken those images or not, I don't know. So a paradigm shift that has happened. So if you ask the students, they are all telling that these are all boring classes. They are not interested. Much of the information is already there, and this is an AI generated image which shows that the teacher is struggling to take class on the blackboard, but the students have turned to the opposite side and they are busy in their own social media recordings. Two examples I would like to give at this junction. There was a survey which was carried out in 5 southern states following the implementation of the CBME, that is competency-based medical education curriculum. As you are all aware that it was implemented in 2019 and the first batch they have passed out. A survey was intended to collect the responses on various components of CBME which were introduced. And there was one open-ended question in the end. Multiple such things were there, and one open-ended question: why would you like to attend theory classes or the large group classes or the small group teaching classes? This was the open-ended question. So many wrote that for understanding the knowledge, for early clinical exposure, or for interaction, and so many things. But the majority of the responses were two. Can anybody just guess them? For what purpose they would like to attend the theory classes or for the small group teaching classes? Is for the MBBS students. Question was asked, open-ended. Can anybody guess what is the majority?
Attendance.
Very good. Excellent. Yes, one was attendance, and the second part, because those who are teaching are our examiners. We need to be known to them. So these are all the two reasons which were considered as the maximum responses. So they are all coming for attendance, and they are coming so that the examiners or the teachers pass them in the theory and the practical classes. They must be familiar with their faces. So that's why the students are attending our classes. So that's the sorry state of affairs with this generation and with all of us. That's one part. Second example I would like to give: a group of software professionals who are working in US. They resigned their job and came back with good amount of money, and they thought of having one startup company. They understood the difficulties in the education system in India. So with good amount of money what they had, they thought that why can't we have one edtech company? So before having this edtech company, let's have some preliminary study whether it can work or not. They thought that our education system is not in order compared to the Western education. So where it is, everything is spoon fed, and students are not given opportunity for critical thinking or analysis or problem solving methodologies are not provided. Then a pilot study was conducted in the state of Maharashtra, where you are all knowing that there is what is known as Navodaya schools, where Navodaya colleges, where the cream of students who are very good in studies are picked up, and the hostel facilities and the accommodation, the food, and their stay, everything is taken care, and they are placed in hostels and very good teaching. So these students were picked up, around 35 such students from Navodaya school in class 11. That means they are in intermediate first or the PUC first year. They were all picked out, 35 students, and they were segregated into a separate batch. And the specialities which were involved in that included, they are not supposed to attend any theory classes. There are no theory classes at all for them, so they can stay in their hostels or in their home. So the information is provided in online mode, and some activities, some discussion once a week physically they need to come to the class. That's all. So this happened for 2 years. So for 2 years this happened, and once in a month experts from the IIT college and from the medical colleges, they came and cleared some important doubts and made the concepts much easier. This is the whole process which was carried out. So students never attended any class at all, only practical classes they attended. There were no theory classes at all. As you know that practical classes are very, very, very limited in the PU or in the intermediate course. And out of these 35 students, 30 students, they cleared the IIT JEE examination, and one such student is placed in MIT, and the rest of them, they are all placed in the prestigious IIT and NITK. This you can search in the net, because I was just watching one TEDx video, and where that edtech company owner, he explained the phenomenon what they did. So this is how our students can be treated, and how it can result in enhancing their critical skills and the improvement in their scores and professional expertise. So this is one such example. Then you might think that yes, majority of the students, as I told, they are all from Navodaya school, and the cream of very good students were picked, and hardly, and the number is very less, and they can do wonders. Then the next part, this same team with more numbers added to that group, what they did, they took this project in municipal corporation schools in Maharashtra. And you know the type of students and their level of intelligence, socio-economic status, everything into consideration. Again, 70% of the students again cracked NEET and IIT following this method itself. That means the success stories are already there, and we need to practice these things in whichever the feasible way, taking into consideration the statutory guidelines. So that's an overview I would like to give for this flipped classroom. So, as rightly mentioned by Chatra sir, flipping of the sessions that happen, what happens in the classroom will go to the home, and what happens in home will come to the classroom. So that's what is known as flipped classroom. And I would like to mention some details about in dental education also. So the outline of presentation will be what's the concept, what are the four pillars, the steps involved, what are the advantages, some examples and case studies. Already have given two examples. So what is flipped classroom? So as I mentioned, traditionally it's a lecture in class, and we give assignments or some works or some homework for the students at home. But what happens in flipped classroom is content is provided before the class itself, and some additional information or concept clearing or the active learning or discussion happens in the theory class. That means students prepare at home, and class time is used for application or problem solving activities. So, what is flipped classroom? It is defined as a strategy that reverses the traditional learning environment by delivering the instructional content outside the classroom. So, it moves the activities like the projects or the assignments or discussions or peer teaching into the classroom. So, what is the basis for this flipped classroom? First, at the bottom level, the lower order thinking is remembering. Next, students will understand. Next, will be applying. Next, will be analyzing. Later, evaluating and creating. So, this is the Bloom's taxonomy. So, we want our students to move up the ladder from remembering to the creating level. That is the higher order thinking. So this flipped classroom is rooted in the Bloom's taxonomy. That means in the pre-class, knowledge and comprehension. That means remembering and understanding. In class, the analyzing, evaluating, creating can take place. That means it's an evidence-based teaching strategy, what we will be doing it. Let us see the process. First, six steps are there. The first step is plan the session. So, can we have all the topics in a flipped classroom? Yes, provided students are exposed to the format of flipped classroom. Don't have all the classes in the flipped classroom itself. Select important topics which you think that these are useful, these are very easy, these can be managed, students can read everything on their own. Don't give very, very difficult topic to make students in a flipped classroom session. Start with some good, simple topic. Identify what are all the clear learning objectives or specific learning objectives, and you can divide that content into shorter segments. That means one is definition, one another is importance, or some different sections of your topic or classification, or whichever the way. Then you need to create or select the recorded video. So we have already created the videos in our, and these are there in the NVIDIA and in the YouTube. or else you can record them using PowerPoint or Zoom or the OBS or whichever, or you can record them at NVIDIA itself. So you need to use the visuals with good examples, good animation, and some questions. These are already there on our NVIDIA recordings. Or else you can use already the recorded videos which are there on the YouTube, which are of good quality, which has covered everything as per your requirement, addressing the learning objectives. So this is the second stage. Third stage, you need to share these videos before the class. That means you need to share those video links to the students, or you can upload them to our learning management system, or you can share them using the WhatsApp group. Share it well in advance, 2 to 3 days in advance, and give viewing instructions, what is expected from them, what they are supposed to learn, what they are supposed to concentrate. They are not watching any movie here where they can be curiously, interestingly attending those entertainment sessions. These are all the lecture videos, so we have to clearly give what is expected, what they are supposed to know. So include a class quiz or reflection questions in the video itself, which are not there right now in our NVIDIA recordings. So you can stick to giving instructions to the students well in advance. Next, monitor student engagement. It's a bit difficult. We cannot keep a track of students, whether they have watched it or not. If the number is small enough, then you can. Otherwise, it may be difficult. Or if it is embedded into our learning management system in Engage itself, where the LMS analytics can show whether a student has watched it or not, or it can be a simple checklist using a WhatsApp or Excel, whether you have watched it or not. If so, what is the answer for this question? Something of this sort can be managed, but this may not be mandatory as such. Monitor the student engagement. The very important is the in-class activities. So what needs to be done? So you have provided already the video to the students. The concepts are already there. So they have read, they have gone through, they have understood everything. So what to be done in the class? So what is the role of a teacher? If there are any doubts, clarify the doubts. There can be a group discussion or a peer teaching, or make small groups and make them to present seminars. Some topics, some concept by for one group, another topic for another group, you can divide, or some case studies can be shown, or it can be a role play or a simulation or a practical demonstration. They can summarize the video, or you can have some case discussion related to that, or any problem solving exercises, or if you have got case based multiple choice questions which are already there, which you have for discussion, you can project them and then have some analysis, or it can be some voting, or it can be a test, online test, or it can be a quiz, or preparing a concept map then and there, only summarizing the whole concept. So various ways you can have in class activity. There are no hard rules that how these activities need to be managed in the classroom itself. So it is left to the teacher to decide what can be the activity, but prepare in what way you want to handle that class. So once that is done, you take the feedback about the video, about the whole session, what they liked, any areas which needs to be improved. It can be discussed with your colleagues also. If any additional information which was not provided in the video, it can be provided, or reflect what helped them, what worked, and what needs to be improved. So these are all the steps which are involved. I repeat again. First is you need to plan the session, then select the recorded videos or create the videos. In our case, we have already have all those videos with us. Share these videos links and instruct clearly what is expected from the students. Then you can monitor the student engagement. You can give some questions and answers session, and then in the class what activities need to be there, so you can plan out whichever the way that is convenient to you, as per your requirement, as per the requirement of the specific learning objectives, and feedback and follow up some additional information that which is not there can be provided. So these are all the steps which are involved in conducting the flipped classroom. Let us come to what are the pillars of flipped classroom. FLIP. F stands for flexible environment, L stands for learning culture, I stands for intentional content, and P stands for professional educator. what is this flexible environment? So all the content is provided much well in advance. That means at leisure time, the student can watch the video as per his wish or her wish whenever they want. That's a flexible environment. And even if the student has missed out attending the class, the video is available, they can watch them. So that's the environment that is provided, which is flexible for the student. And even for the teacher also, already the job is done. Only the discussion or some additional information or some problem solving exercises or some discussion or seminar need to be planned, and this will be handled by the students itself. And the role of a teacher now becomes what is known as facilitator. He will be just a guide. The learning culture, and we use many times we use these student learning teaching learning methods, learner centric teaching learning methods. Hardly we use them, but this is one such example where the learning culture, the active interaction that happens, so many discussions that can happen in the lecture class itself. So the question which I asked, what is missing in today's classroom, the interaction can be brought here. So the learning culture where the learner centric methodology of teaching activities can happen. Intentional content. So it is left to the teacher what can go as a flipped classroom. And the easiest of the topic or the difficult I want, so that can be picked up easily. So it is the intention of the teacher to decide which topic can come into flipped classroom. That feasibility is provided. And professional educator, so the role of a teacher now becomes facilitator. Hardly we become facilitators in our 250 MBBS or 100 of dental school. So now we actually become what is known as facilitator, and we actually take up the hat or the role of being a guide or a facilitator, providing feedback and additional information. We are enhancing their critical abilities or thinking skills in the classroom itself, which otherwise used to happen, which we are not aware whether it was happening or not at their residences. Some of the examples. So in pre-class activities, you can give an online video or some resources. This happens at their home. In class activities, some quizzes or some seminar presentation, some assignments or some discussion can happen in class activities. And after the class, any questions which have been left out, any instruction which need to be provided, so this can, and what went well, the feedback and assessment will be a post class activity. This is another example which was practiced earlier in 2018-19, and also it was modified in 2020 and 2021, where online instructor created information was provided in the form of lecture slides and the videos, and in class discussion happened and case scenarios were discussed, and post class activity there was review and assessment happened using the multiple choice questions and student satisfaction. Another such example, before the class you provide video lectures, or it can be quiz, reading assignments and PowerPoint slides. During the class, student teacher interaction and doubt clearing can happen. So here what is happening is flipping the class. So you can see that in traditional model, understanding, remembering happened in the classroom. Applying, analyzing, evaluating, creating outside the classroom, we are not aware whether it was happening or not. And keeping in view the guidelines of the Bloom's taxonomy, addressing it. So what is now happening in the flipped classroom is remembering and understanding is happening outside the classroom, because we are providing all the information well in advance. Applying, analyzing, evaluating, creating happens in the classroom. So that's the whole concept of flipped classroom. So can anybody now list out what are all the advantages of flipped classroom? I need some responses. What according to you are the advantages, and what according to you are some disadvantages? Am I audible?
Yes, sir.
Yes,
Said, yeah, according to me, advantages we can actually inculcate self-learning culture among the students. Disadvantage is also the same. We are not very sure that whether they would do it. It might take some time to, get them into that culture.
exactly correct. So we are facilitating what is known as self-directed learning mode for the students, and we are not sure whether this will work out or not. 100% this will work out, but we need to make a start. So that's one concept. Let us take any other advantages, disadvantages.
Student interaction in
Yes,
the
yes. In the classroom, the time is provided not for discussion, and we will not be looking at the time when I can complete the topic and I can move out. So much time is provided for interaction, for discussion. We can have case-based scenarios, one multiple choice question, which is case-based, and discussion can happen that some observation values or the lab diagnostic reports or some case sheets. It can be shown there, and based on the topic which you have given for them to watch in the form of a video, these can be discussed. Summary can take place, a concept map can be prepared. So these are all the advantages of flipped classroom. So it promotes active learning, critical thinking. Student takes the ownership, they have to read it, they have to go through the video. Contents are easily accessible as and when they want, they can watch them. That interaction can take place, self-directed learning can happen, student motivation and engagement, because the discussions and the doubts which the student they have, these can be clear. And many times students are afraid of asking questions in the theory class. This what I have observed, that everybody, we have observed that students will be having so many doubts, but they fail to ask any question. So what I did, this I have been practicing from 2016 itself. I have created one discussion forum on our learning management system. Any doubts, either it can be the simplest of the silly doubts, they are free to ask that question. And all other students, they are free to respond to that question at all. So if nobody is answering in 2 3 days, I will be the facilitator, I am going to respond to that question. So this is happening from 2016, and every time I take nearly some 25 hours of 35 hours of central nervous system topic. And in the end of 35 hours, there will be not less than around 150 to 170 questions which were asked by them, which were replied by the other friends. And also they have shared additional information from other textbooks which was not there in my class, or they have shared some related articles which are there on the PubMed or the Scopus, or they searched some information in the net which they have not understood, they are asking for clarification. So that's how things can definitely work out. So such questions can be taken up, and these can be discussed in the theory class itself. Cooperative learning,
Uh,
everybody takes the, yes.
yeah, the another, I'm sorry to interrupt in
Yeah, yeah,
between.
yeah. Please, please.
Another challenge is rather the disadvantages.
I have
So
not
lack
come to
of
the
preparation.
No, I have not come to the disadvantages.
Okay, okay.
Yes,
Sorry.
yes, I'll definitely come to you. So emphasis on cooperative learning. So everybody, it can be in the form of a group of students. One who is silent definitely will come up and he'll ask questions, and he will be there to help that in the discussion process. It gives more time to explore the content, additional information. So the critical thinking abilities definitely can improve. So, what is the flipped classroom is not. Don't be under the impression that it's an online course where everything is provided and they have to go through everything. So, our role is nothing. So, it's not an online course. It is not a replacement. It's not online video sharing. We are not replacing the teachers with the videos, and students working without any structure. That is not flipped classroom. And students watch the video on their own, nothing after that, no discussion. That is not a flipped classroom. And they can work in isolation? Definitely not. So what is flipped classroom? There is interaction, personal, teacher, student, content. Students, they know what they are supposed to learn or understand. Teacher will be a guide, not a lecturer, or teacher will be a facilitator. It's a mix of teaching and active learning. Even if the student has missed out, so he can definitely attend those videos, watch them, understand, and others students can definitely help. So all students will be taken into consideration. They are always available for review, and every student will be actively engaged, and there can be a personalized learning for at all. So what is the role of technology here? So either it can be a video lecture, it can be a narrated PowerPoint presentation. You can use the learning management system. You can use our Engage. Sorry for that yum. It can be in a form of online quizzes, or it can be discussion boards, which I explained right now, or it can be you can use the various tools. Either it can be a Mentimeter or Poll Everywhere or Kahoot. So what will be the role of a teacher? It shifts from content deliver to facilitator. They'll be guiding the problem solving or some case discussions, and they give immediate feedback to the students, and they support the students and for collaborative learning and for deeper inquiry. So, what are the benefits in dental education? So, I had to search the details on the internet. So, I'm just summarizing whatever I found. It is for better application of biomedical knowledge to cases, enhanced problem solving in clinical scenarios, more effective use of faculty expertise, encourages self directed learning. I found some of the case studies. So this was in 2018, where the dental students learning attitudes and perceptions of YouTube as a lecture video hosting platform in a flipped classroom, which was conducted in Korea. So a good content of already available YouTube videos on the dental topics were shared with the students, and 77% of them watched the video before the class, and 83% of the students found that it's easier to understand compared to the in-person lectures, and 74% intended to review them again after graduation. That means the quality of presentations were very good, and in fact these were recorded by those teachers itself who were part of the facilitating team. Another one, effectiveness of flipped classroom for undergraduate in implant dentistry hands-on course. This was in 2024, the latest one, where the undergraduate BDS students prepare with implant surgery video tutorials before hands-on practical practice simulation models, and the students in the flipped group showed better accuracy in buccolingual implant placement compared to the traditional lecture group, and the satisfaction rate was more than 90%. This was in prosthodontics in preclinical skills, shifted theory and demonstration videos outside the simulation lab, and increased available time for deliberate practice, and students reported significant improvements in manual dexterity development compared to traditional teaching. This is again in 2024. Another one, impact of fully online flipped classroom on academic achievement in undergraduate dental education and experimental study. This is in 2024 again. Here, the pre-class video lessons with case questions and online sessions for case discussions for interactive application were shared well in advance. And these students who underwent the whole process, the score significantly higher on academic achievements, and the student satisfaction level was much higher. A systematic review involving multiple articles which are published in flipped classroom, they summarized that 60% of the students they use technology for their learning process, And 80% of them, they showed that increase in the grades, and 95% of the students believe that the video lectures enhance their learning. 73% of academic staff, they are mentioning that they are already using the digital content as part of flipped classroom, and 60% of teachers who have flipped classrooms believe that online learning can definitely increase the student motivation. This is a systematic review summarizing multiple articles which are published in flipped classroom session. So coming to the challenges and disadvantages, yes, sir. So you are telling something, I interrupted you. So you can continue, please. So what are all the difficulties, or the challenges, or the disadvantages according to you in flipped classroom? Hello.
So difficult in making the students interact.
Yes, difficult to make the students interact. So how it can be overcome? So one way, just I gave an example, you cannot expect all 100 students to talk in the class. As I mentioned, so you can use your learning management system. They can pose the question then and there itself in the LMS. That's itself in enough. That means they have interacted there. That means they have asked the question there. Asking a question itself can be an interaction. That starts the moment they get that confidence, then they start asking questions. They may communicate that question to the neighboring friend itself, and that neighboring friend who is confident can ask. So that way it can start. The process need to be started. That's why.
So now we have been asked to do it on Google Classroom rather than Engage. So how do we proceed, sir?
You can share your YouTube video that is in NVIDIA recording. Give that link in the Google Classroom. That's it. You need not have to create anything fresh video as of now. Whatever recorded videos in the NVIDIA which are already there on the YouTube, those links can be shared using the Google Classroom.
Sir, may I come in here, sir?
Yes, definitely.
So Google Classroom has a feature where you can give the YouTube link directly on Google Classroom.
Yes.
So, so it is much easier in Google Classroom, and also because we have the workspace license, we have better accessibility to Gemini, which creates a lot of questions based on the video that we share.
No. What I am telling is the video has to be shared now, which is already recorded in the NVIDIA. That's all.
Correct.
How you are going to have the activities is left to you. Whether you want to use your Engage or whether you want to use your Google Classroom is left to you. No problem. But right now, use the videos which are recorded in the NVIDIA. That's all.
True, sir. I was answering to the question
Yeah.
Since we are asking them to do it on Google Classroom,
Yes.
it is only making things easier, not difficult.
Yes.
Fine, I wanted to clarify on that.
Yes.
Thank you.
Yes. Fine. Yes. Yes. Any other challenge? Do you expect that all students will like this?
Yeah.
There can be nearly 30% of the students who want every teacher has to teach.
Yes, sir. Because when I take a feedback onto the students, whether you like the visual, because I use some of the large group teaching methods. To my surprise, as you said exactly, the 30% of the students still like the traditional, lecture based.
Exactly.
How are we going to approach them is also a question, because as we all know, different styles of learning has to be taken into account.
See, I am telling here that you need not have to convert all your lecture classes into flipped classroom. That is number one. If you are taking some 60 hours of theory classes are there, and you already recorded some 3 videos in our NVIDIA, use those 3 videos only for the flipped classroom right now. And if you practice this system of implementing this flipped classroom process effectively, students will definitely like it. Take it from me. take the feedback after conducting an effective flipped classroom according to you. If you are satisfied and if the students are also satisfied, definitely they will pitch in. I'm not telling that convert every class into a flipped classroom. Convert some classes, the videos which you have already recorded, which are already there on the NVIDIA. So time and effort to prepare the resources, we don't have that challenge because already the videos are there. Faculty training in technology, we are much ahead in faculty training. We are all well versed with that. Student resistance, extra workload, we have to watch them, may not be that much relevant. The information overload, that's why usually that's the instructions that we have given before recording any content on the NVIDIA. Limit your content to not more than 20 minutes. So that may not be a problem at all. There won't be any overload. So what are the simple tips for implementation? Start small, flip one class or one topic. That is the first thing. Keep it very simple. Use a simple video or simple topic which you have recorded. Avoid overload. Focus on key concepts, some discussion, show some case study or some multiple choice question or some discussion forum or seminar presentation in the class. Let them reflect what went well, and if there are any areas for improvement, this can be adopted for the next time. So to summarize, flipped classroom, student-centered active learning improves clinical readiness in dental graduates, needs careful planning, training and evaluation. Let us just watch one small video which summarizes everything whatever I have told. Whether the audio is clear?
No, sir.
Okay, then I'll share this video later. So these are all some of the references. Thank you very much. I have flipped my thank you itself. So if there are any doubts, any clarifications, I'll share those videos. So they are very simple videos, multiple videos which are from dental faculty. They are already there.
Sir, for large
Yes.
group, that is the full classroom, I think it is difficult to implement. The smaller groups may be more effective, sir.
Madam, 250 students we have managed, madam, with the flipped classroom. So what we did, we shared the videos well in advance, and in the lecture hall itself, you know how small our lecture halls are. 250 students were divided into 5 groups in whichever the corner. They can go there and they discuss. I made one as a facilitator, one as a team leader, 2-3 students as team leaders, 2-3 students as timekeepers, and 2-3 students as notes maker, and 2-3 students as presenters, and some other or assistants. So they prepared the full seminar and they presented in the group, and the team leader came and presented for the whole class. 250 students can be easily managed. Forget about 100, even 250 can be managed in the lecture class itself. This group can be given one task, another group can be another task, some case discussion for one group, one for seminar presentation. So whichever the way, you have got 100 students, that can be easily managed. That planning is very essential. If plan A fails, be ready with plan B. And keep always in mind that technology is here going to stay. Technology will not replace the role of a teacher. AI will not replace the role of a teacher. Technology in the hands of a passionate teacher will be definitely transformational to the students. That is, take it from me, they'll definitely like this whole process. In fact, they want all such classes to be in a flipped classroom itself for MBBS students, which have taken feedback to the extent of 98% of the students they have given highly satisfactory with this mode. Students are not coming to listen to our boring theory classes. That we have to clearly understand. We have to take up the roles of teachers to be converted into facilitators. They are not small kids, because the information which is available on the net is much, much more beyond our expectation. Everything is there. The quality information is there on the net, and why they have to come and listen to class, and they should not tell that we are coming for only for attendance and to pass in the examination. And if we just introspect ourselves, then where we stand. So that should not happen to us. So we need to shift our way towards being the facilitator and guide. So recently there was one article which is published. Students have changed, technology has changed, world has changed, and we the teachers have to change. So that's I didn't show that article, so I just missed out. So we need to incorporate these things and make some difference. Any questions? Anything?
Ashwin, sir.
Yes, sir.
It was a very good and good lecture. I think we had gone through it, and I gave the opening remarks as well. Now I'm giving the concluding remark as well,
Yes.
along with this. It was wonderful listening to you, and we understood what is the flipped classroom is all about. I think whole of our class, around 60 people of our staff members out of about 26 have attended this particular program, half of it.
Yes, sir.
I think they understood what is the flipped classroom is all about. And he gave us an idea how this flipped classroom has evaluated in our university by taking into a feedback from the students, why students are coming to the theory classes as well. It's basically coming for the attendance and good get familiar with the staff members. Only two objectives. There
Yes.
was no learning objective was there.
Yes, yes, yes.
So this was a very essential thing wherein the flipped classroom, it makes the mark in this area so that it will be better off in a, coming years to come. Second thing is that to all the teachers of the NFI Dental College, I would wish to say that this all the classes which are there we have now, currently designated by the Dental Council of India, should not be converted into a flipped classroom. Few of them may be converted into a flipped classroom. Take the essential idea, if you do not have it from the Dr. Ashwini Datta sir, so that we can able to achieve a certain goal, at least in this year onwards. Thank you so much, sir, taking your time out, sir. Thank you.
Thank you, sir. Thank you. Thank you, everybody.
Thank you, sir. I request all the participants to kindly fill in the Google form which is provided. And we will also be sharing the link of this recording to the respective departments. Thank you.
Thank you.
Thank you, Vinita. Thank you.